Hello, and welcome to Mental Health. It's a Trap. We're your hosts, Susan and Stephen, mother and son, unraveling the complexities of the mental health traps people fall in. Join us on this podcast journey as we demystify the mental health labyrinth, explore common issues, and provide you with tools to navigate this sometimes extremely daunting terrain. You can expect engaging conversations, personal stories, and probably also have a laugh or two. Access to mental health care should not be what causes you additional stress. We invite you to follow along, and together we can embrace the darkness.
Welcome back to part 2 of Complex Medical Issues in Children, Kabuki Syndrome, and Medical Trauma with Becky Searles and her and Daniel's story.
Frustrating. Yes. So I think that's, I think it's helpful to kind of at least know, and you shared a few different ways that people can, reach out, ask for resources, ask for the social worker, if you personally are experiencing complex medical issues or someone that you're caring for, whether it be a child or an adult or a young adult or an older adult. And because there's no age doesn't matter, right? In the medical world, you're seen as a patient. And so I think it's important for providers, including mental health providers, to just be listening and to really make sure that they're understanding where that other person is coming from when you talked about mutual respect, right? By being able to respect one another, to say like, hey, well, my doctor did go to school, has his degree, did his education, so he understands how the body works. They don't really teach how the person works, which is like the mental health side, right? Like we learn more about that in that realm. And I think it's important to be able to bridge those two because we're working with a whole person versus like, I'm just going to work with this little medical piece. Yeah, go see your mental health provider for the other stuff. It's really, if you want to talk, use the word partnering or having that partnership to really meet all needs, because we know that medical impacts mental health and mental health impacts physical health. So, yeah.
And, I think that's just it too. Some of our best doctors who I have the utmost respect for and, I'm beyond grateful for, is the same doctor who will go in to see and he'll be like, Beck, I got nothing. I have no idea, but let's figure it out together. Like, I don't know why this is happening. I haven't seen this before. We're going to figure it out together. Or if I come to him and say, this is something that's new that we're starting to see. I reached out to other families, who have a child with Kabuki, and these are similar things. And this was the concern that came up, or this was the underlying cause. It's not dismissed. It's like, okay, let's figure out what's going on then, because you guys, again, have the life experience. I have the book knowledge, but you have the life experience. And those are the doctors that I just cherish because, again, it's that partnership.
Right. And the ability to take ownership of, I don't know.
Yep.
Because we don't have all the answers. The professionals do not have all the answers. And so sometimes it takes that partnership to kind of figure out, okay, so what are you seeing? What are some of the symptoms? What are the things that are happening? And doing the research and exploring the possibilities of what might be going on, and I think that speaks volumes to having a really good relationship with a provider to be able to say, I don't know the answer. Well, let's figure it out together. I think that's great.
I also think understanding trauma, which they should have some basis of, but obviously not all of it, because any surgery, any cut, any broken bone, anything like that is considered trauma in the medical field. And then there's the additional part of when people experience trauma, it's just traumatic, even having to go to a hospital or see a doctor. And if they don't, I mean, I would hope that they would understand it, but then there's that other layer, right, of I don't know if it's they ignore it or if they forget about it, or again, if they're not trained, like how trauma is impactful, like just like blood pressure. Like if you go to the doctor and you have like a really high blood pressure, but it's just because you're at the doctor's, not because you really have high blood pressure, how that could be not necessarily a trauma, but maybe a trauma symptom that someone has because they go into it. And so then again, when we think about Daniel as a child going in and having these negative experiences and having these, you know, a-hole doctors who just do what they want to do because they're the adults and they're the doctors, how that impacts, like you said, his future of getting care and getting like passionate and empathetic doctors who will want him to live a healthy life and not keep him from accessing healthcare and doctors and any other systems.
Yeah, and I think another piece, and so one of the things that I did, because I was getting very frustrated with with our hospital systems, is join our hospital has a patient family advisory committee. So I joined that in order to help just kind of work on change, like identify what are problems, figure out how do we make it better. And so in kind of, doing that process and learning more about both sides of the coin, right? I think one of the problems that we have is that the medical field is so time limited. Like doctors' appointments are so, here's your time slot, and it's never long enough. And God forbid if you say, you schedule an appointment because you have an ear infection and then you go in with like, a cut finger at the same time. And then it's like, oh, we have to schedule another appointment because we don't have time because the appointments are this long. And so then I think one of the challenges is, if I bring my son in and they want to do something, but that's going to require extra time, then how do they then accommodate that in their schedule because they're booked back to back to back to back? And that's one of those, not my problem. I can also understand that it's their problem. And so they get very stressed out and frustrated about that. So I think part of it too is also, when facilities are booking things, like understanding their patients. And that's something I don't have an answer for, other than, working to find the right place, for whether it's your child or, somebody else, or even yourself. And that was one thing we had, like we had that exact experience, provider who wanted to do something. And I said, we're going to wait for child life. And they were like, oh, it's not a big deal. And I was like, it is for him. Like, this is a big deal for him. So if you want this, then this is what it's going to take. We ended up working a way to figure it out, but we had to get creative. And I feel like sometimes providers are just stuck in the, I have to get out on time, and not, what does my patient need? And Susan, I know you are in a medical office. Do you see that with your providers?
Yes, because it's the way that our systems are, the way that they're creating the systems now, right, is that it's limited appointment time, and it's a bigger systems issue, right? That's a huge systems issue because it's happening in all of our medical facilities. And, and the doctors, the providers are feeling stressed over it because, again, it's like, I have to stay on time so that I can get to see all the patients that I need to see in a day. And, my personal view is we're going more towards quantity than quality.
Yep.
And even in my personal experiences with my own providers and my own healthcare. And, that's frustrating to me because when you're talking about complex medical issues and I have to advocate for a patient who has complex medical issues that are significantly impacting mental health. And so, our providers will say, well, it's their anxiety and it's their depression and it's this and that. And I'm like, let's talk about the list of medical issues that this patient has. And so your 15, 20-minute appointment is not going to cut it. So there are times when patients can request a longer appointment to address multiple needs, and I don't know that every facility does that, though, when it's complex medical issues, these 15, 20-minute appointments are not sufficient because there's multiple things going on. And, they may book an appointment for one thing, though other things may have occurred leading up to that appointment. And so to me, it's I don't know if it's an insurance level thing. It's much bigger than the providers and how we now schedule patients to be seen. And so, and I work in mental health. So mental health, I schedule my own time, and it's regular therapy appointment time. It's not these little 15-minute window or 20-minute windows. So, the medical side runs very differently. And, it's fast paced, it's quick, it's moving. And when you have someone with complex medical issues, how do you move them through a system that works in that way?
Well, so it's interesting to hear you say it's fast paced and it's, kind of that go, 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 especially if you're talking complex medical. And a lot of times there with complex medical comes different degrees of kind of cognitive levels and cognitive challenges of different types. Whether that be processing, challenges and processing speeds and things like that. My son, for example, the world moves about 20 times faster than his brain does. And so, you're kind of starting at the starting line and you're already, a good solid 10 feet ahead of him. And he's like, I don't know what's happening. And that then will trigger him to struggle with behaviors because he doesn't understand what's going on, right? So this fast-paced environment is not conducive to him. And so I need providers to slow it down and to explain things to him, but give him time to process it and give him time to ask questions. But he needs that extra few minutes to think about the information so he can develop his questions. And so that, I think, is a prime example of the environment and the facilities and all of those things are very go, go, go. But a lot of complex patients, just their physical being is not, and then we expect them to keep up with everything.
Right, which is like impossible. And you're asking someone to do something that they just don't have the ability to do. And we need to be mindful of that and aware of that. And then maybe it's for people who have more complex medical issues, like how do we schedule those appointments? Because these one-size-fits-all models don't work for human beings. We don't fit in the darn boxes, people. When are they going to hear that? My big pet peeve is the box.
That's fair. We've never fit into a box. Yeah. I don't even think we own a box.
If we do, I think it's not something that can be successful to helping people, And so I think just having that intentional awareness of, all right, so I have this child with complex medical issues. So I need to allow for time in that appointment to extend that appointment time a little bit longer. So if it takes up 2 appointment slots, then that's what you need to do. I don't care what the insurance says. I don't care what the world says. I don't care what administration says. We need to be able to meet the needs of the individual that we are working with. And you might have other patients that are, they don't have complex medical issues. They're coming in because they have a hangnail. Okay, cut the hangnail, off they go. 15 minutes, done. It's the one size fits all. It's like this box mentality. So everybody has to only be seen. They get 15-minute appointments or 20 minutes, whatever they are. They changed them a little bit. And some might be 25. So it's being able to, to meet that. And then patients get frustrated because they're feeling like, I only have such a short amount of time. How am I going to get all this stuff in? And then they're told, oh, you need to schedule 4 more appointments for those 4 other issues. number one, right? Providers are feeling frustrated because they are trying to meet the needs of their patients, though they have to follow this model. And so if I let this patient run over by 10 minutes, that pushes the rest of my day out. And I'm here an extra hour or two at the end of the day trying to play catch up. So there's got to be a way that we can make these things work. I don't know what it is. I don't have the answer. There just has to be a way.
Well, and something that I hear really pretty frequently, and another kind of challenge that if you don't live in the complex medical world, you don't necessarily know, is when you have a child who's kind of in the in between, with a foot in pediatrics and a foot in adults. So in New Hampshire, you're an adult when you're 18, but if you have complex medical and you have, different types of abilities, then you are typically able to remain in the pediatric realm until you are 22. So like right at the end of your 21st birthday. But what's interesting though is, because that is not an across the board thing. So in some areas, so dental is a perfect example. A lot of pediatric dentists will not see kids who are kind of in that 1 foot in, 1 foot out place, but yet they still have pediatric health insurance, but they have to go to an adult dentist. And that's a really big challenge, right? We know dental health impacts mental health significantly, but these young adults who are kind of in this transition period lose access to services simply because we can't find providers who will take the insurance piece, because it's still considered pediatric insurance, but it is adult world dentistry. It's mind-boggling, the kind of nonsense that we have to deal with. And then you also have the fact that there are not enough adult providers who understand pediatric congenital medical challenges. So I say that, that we have a lot of great, wonderful doctors in the adult world who can do kind of your everyday normal stuff. Then there are doctors who do like more specialty, right? Like, oh, this person has Alzheimer's, or this person has, a heart condition because they had to have bypass, kind of those, it's like adult problems, right? That we have specialists for. But finding adult doctors who specialize in having complex medical from birth, they don't understand those complexities and what that looks like in the body, and how that, because it hasn't worked right from day one. So as it ages, it's going to look even worse and it's not going to match anything in the textbook. And so it's actually really hard. And a lot of pediatric patients who are complex end up having to stay in their pediatric providers for extended periods of time, because they have nowhere to transition them to. I know of one adult provider who sees complex medical, and quite frankly, like, we need to just clone this woman. Like, she is the it person. But you can't get in to see her because, her wait list is just so incredibly long. And, it's frustrating because there's so many kids like that need a place to transition to. And how do these facilities make that profitable? At the end of the day, it comes down to profits. And that's a challenge.
So you talked about the PFAC that you are a part of, and what would it be like to bring that topic up, to maybe train some providers so that, they can have more providers that can fill that gap?
So I have. And and it was interesting conversation with the physician that I spoke with, because they're well aware of the challenge. Everybody agrees. It'd be probably cheaper to just clone this person. But, one of the conversations came down to the funding and financing of a department like that. Because oftentimes, and this is again where it gets very frustrating, when you're talking about complex medical, oftentimes you're now going to be dependent on state Medicaid funding or Medicare funding, which don't pay very well to providers. That's always been one of the struggles. And so automatically we're looking at how there is disparity simply because you have complex medical and because you are, having to utilize state insurance. You're not able to access the same level of care because these facilities can't maintain and stay open because they're not getting enough funding. So it's a frustrating piece because it's so much needed, but financially can't stay viable. There have been other states. So part of the conversation that I had previously was that there are other states who have figured out ways of making this type of complex care model work, but it looked a little different. And so I know there's been some conversation and some talks with other states about how did you get funding for it? How did you work within these boxes to meet our out of the box needs? And so it's one of those where I feel like it's an issue that's a known issue that we have not figured out a solution to in the state of New Hampshire. But we really need to, because we could easily fill an entire clinic. And that's the frustrating part, is it's not that the need isn't there, it's that we just don't have a system that can work within the boxes.
Or outside of the boxes.
I wouldn't care where it was working if it just worked.
And I think that's
inside, outside, upside down, doesn't matter to me.
Mm-hmm. And I think the big thing too is as the big thing for all professionals is that educational part. So could there be some training, although it's basic and not enough, but is there, when we trying to think about solutions, is there a training that people can take? And then why aren't people taking it? But to have to better serve, their patients and the communities they work with, because it's just going to do us more harm if they're not, doing what they need to do to stay up to date with, medical issues, complex medical issues, and then just any other issues that they could come across.
And again, I think that also goes back to how is the system set up for providers? Is there time for training? I know as a mental health clinician, there's never enough time in order to do all the trainings I want to do. And so when you're booked back to back so much, then it's hard to be able to do that, because then it's, you're doing it on your off time or you're having to take time off, so, I think it's a big issue that directly impacts patients, directly impacts providers, but is bigger than both.
Yeah. And then it's also one of those things when you're like, why isn't it being taught in school? We think about especially complex medical issues, it's like, well, why can't it start there? And then it's another whole topic to go down.
Yep. Oh yeah, exactly. And I think some of the kind of taking all of these pieces into account, some of what I do with the families that I work with who have kids with complex medical is also helping to educate parents on the fact that you can say no. You don't have to say yes to anything. You can say no. You can say not right now. You can say, I like this idea. Here are the things that we need to have in place in order to do them. And also doing work with, again, sometimes the services that we have are not utilized enough. So I'll talk to parents and say, okay, you know the procedure your child's going in for. Let's make sure we call Child Life. Let's call BRT, ask them for a social story. Most of them already have them drawn up and can literally just email it to you. Or ask, do you have a video? Thank you, YouTube, kind of an amazing thing of what is it going to look like when my child goes in to have their tonsils removed. I could probably find a video of a child actually going through the whole process at a children's hospital right now. So utilizing some of those tech opportunities to help kids kind of see like what's going to happen. And then also giving them time to ask questions. I feel like, doctors will come in, they'll do their whole big spiel. They'll say to the parents, do you have any questions? And parents will say no. And then out the door they go. But for us, that is not, my answer is always, do I have any questions? I don't. Daniel, do you have any questions? Because ultimately, he's the one who has to go through this. And sometimes his questions are spot on. And sometimes his question is like, is your dog named Rover? And it makes no sense. And the doctor will answer, and he's good to go, but like sometimes he just needs to feel like he's gotten to have a say in something. But helping parents to just realize like you can slow things down, you can control the pace a little bit, can be helpful. And honestly, sometimes just telling parents, you have the right to say no. You don't have to go forward with everything immediately right away. Sometimes that alone of just hearing that can be really, really helpful, because it's true. It can get very intimidating when you're sitting in a room full of all these doctors and everyone's on a time frame and, it's go, go, go. It's like, no, we got to slow it down a little bit because this isn't working.
Mm-hmm.
Yeah.
Well, I think that would be a perfect ending for this episode, just because it's always good. We want to make sure that people leave with some tips. And I think that's a big thing, is communicating, advocating, saying no, listening to your gut or what your body, if your body is like tense and stressing out, then maybe it's, I need to think about that. Or again, and also advocating and allowing children to ask questions, because if they go through their life with their parents asking all the questions or their guardians, then when they get older, they might never ask a question because someone's always asking it for them. So I think in part it helps, children learn to have a voice when they go into the doctors or when they get older. And if they're living their own lives, then if they're still getting their medical care, then they have the ability to voice and have that awareness of the resources that are available in the area. So it was awesome having you on, Becky. Do you have any last words, Mother?
No, thank you so much for having me. I really appreciate it. It's been great, and hopefully I can come back another time.
Well, we will definitely love to have you back, because you have a lot of knowledge in a lot of different areas that I think can be really helpful to others who will listen. And I hope that people can take away some of the resources and recommendations that you have provided if they are working with medical teams or mental health teams and complex medical issues, and hopefully navigating those systems a little bit better.
Absolutely.
And of course, if any listeners have any questions or comments, please feel free to leave them in the comment section. Of course, we might not have all the answers, but we definitely think that having these conversations are helpful, because people might have had these experiences and have never had the opportunity to advocate for themselves. So hopefully if you hear your story in Becky or Daniel's story, then hopefully it helps. And again, if there are any questions, we would love to continue this conversation, and we hope you all take care.